Here's a segment from this month's edition of St. Charles Parish Today, a new monthly local talk show.
Along with the familiar October colors of orange and black comes shades of pink. That's because for the past 27 years, medical professionals, volunteers, and support organizations have made October's breast cancer awareness a force to be reckoned with in national discourse. And while a cure is still to be found, strides have been made in the areas of detection, treatment, and the public's general knowledge about breast cancer, which about 1 in every 8 women in the United States will develop over the course of their lifetime. With me to discuss new information about this topic are St. Charles Parish Hospital Director of Imaging Services, Peggy Smyra, and breast surgeon, Dr. Eliana Soto. Thank you both for being on the show today to talk about this important subject. So most people know that with cancer in general, that the earlier it's discovered, the better chance there is for treatment and possible remission. What should women be doing at different ages to make sure that they're being screened properly for breast cancer?
Well, Renee, thanks for having us here today about talking about this important topic. It's important to remember that each year 200,000 women are diagnosed in the U.S. with breast cancer, so that's a pretty significant number. The most important tool we have to screen for breast cancer is mammography. Mammography will pick out tumors that are too small to be felt. And they also can pick out microcalcifications or deposits of calcium in the breast that could indicate that someone has a breast cancer. In terms of how often to do mammograms, there was a little bit of confusion a couple years ago, 1 year ago, because of new guidelines that were put out by the U.S. Preventative Task Force. And these guidelines were different from what we had been recommending. However, I think by now most surgical and cancer societies have recommended that we continue with the guidelines that we had been using prior to this. Okay. The recommendations are that women starting at the age of 40 have screening mammograms annually. That is for women who are in the average risk group. For women who are in higher than average risk groups, such as those with genetic mutations like the BRCA1 or BRCA2 or strong family history, the recommendations may be more frequent and to start at an earlier age. In terms of self-breast examinations, these haven't really been found, recent research shows that they really haven't been found to make a dent in death rates from breast cancer. Therefore, and this can be due to just the fact that women often don't know exactly how to do a breast self-examination correctly, or they also do it at varying times or periods, so therefore now we really recommend, at least in my practice, and I think most doctors, that we still recommend that women do them starting at the age of 20s or the age of 30s, but it's not such an important recommendation as it was before. In terms of clinical breast examinations, they should really start it in when a woman reaches the age of 20s and 30s. It should be done by a health professional, and it should be done at regular intervals when they go in for their regular checkup. So in the 20s and 30s, a woman can have a clinical breast examination by a health professional approximately every 3 years, and then in their 30s, they can start having them annually. In terms of higher risk patients, like I said before, they could include earlier screening mammograms, more frequent screening mammograms, and also the addition of other diagnostic studies such as MRI. So that's all important to discuss with your doctor.
Okay. Did you have anything to add?
Well, during the month of October, we have added some morning and afternoon appointments in our mammogram department to better accommodate the residents of the parish and also surrounding communities. Our mammogram department is digital, and it is accredited by the American College of Radiology. We also have some new radiologists on staff at the hospital, and we hope to be able to provide more biopsies. We also have Dr. Eliana does some breast core biopsy with ultrasound guidance and mammography guidance as well. Early detection is the best thing, and a mammogram's goal is to achieve that. So if you find, like Dr. Eliana said, a breast cancer early, then the odds of your survival rate increase. So it only takes 15 minutes to have a mammogram.
Right, it's so important. We encourage people to do that for sure.
You can save your life in those 15 minutes.
Right. So what are some of the treatment options out there currently for breast cancer, depending on maybe what type of cancer the person may have?
Well, the mainstay of treatment is still going to be surgery. there have been some changes over the last 10 years in the treatment. The treatment like you said, depends on the stage. Depends on also the overall the stage of the disease and whether or not it's gone to the axilla. But it usually involves either a lumpectomy or a mastectomy, which is complete removal of the breast. It involves chemo and radiation therapy either before surgery, after surgery, or before and after surgery. It involves doing special surgery to evaluate whether the cancer has spread to the lymph nodes of the axilla. And it will usually involve taking an anti-estrogen drug such as tamoxifen or Imidex for several years after surgery and chemoradiation therapy.
Okay, so you mentioned mastectomy, and that's necessary in some cases. What are some of the options for women who want to get breast reconstruction surgery?
Well, breast reconstruction is very important. I think a lot of women throughout the country often don't know their options. Breast reconstruction is necessary, is something that is done when mastectomy is necessary. When a woman has a mastectomy, what I often hear is that women, they don't only go through a physical toll, but an emotional toll as well. And they often feel that they have been mutilated. So in order to help a woman restore her self-confidence and not have that feeling, we recommend breast reconstruction, either staged or immediately during the when we do the mastectomy. Okay. The surgery, breast reconstruction can either be implant-based, so you put implants in, or it could be using a woman's own tissue. Most of the time this is used from the abdominal tissue, so a woman will actually have like a tummy tuck in addition to having her breast or breast reconstructed. So we work hand in hand with the plastic surgeon to make sure that the patient has the best oncologic and cosmetic results.
Okay, well, that's very good information. And one thing I wanted to bring up in this interview is that many people don't know that men can get breast cancer, although probably not as high as a rate as women. But what should people know about that?
Male breast cancer is definitely not as common as women. It's about 1% of all breast cancers that are diagnosed. Male breast cancer is a lot of times associated with hereditary conditions such as BRCA2, or men who have strong family history of this. It usually presents at a later stage because men, obviously they usually don't do breast self-examinations. They're not used to feeling the different lumps that are normal in their breast and noting for any changes. The presentation is usually a palpable mass, a lump in their breast, but it could also be just like in women. It could be crusting around the nipple, retraction of the nipple. The treatments are usually similar as to a woman. The only difference is most of the time they get mastectomies instead of just taking the lump out.
Okay, and you have anything to add on that subject?
No, we do mammograms on men all the time, so it's not anything unusual for us.
Right. I think a lot of men should take heed to that, and make sure that they're checking themselves out for that.
Most definitely.
Okay, well, finally, what can people do to prevent breast cancer from occurring?
Well, there's nothing that you can really do to prevent the breast cancer because we're not sure of exactly what causes it, and there are a lot of risk factors such as genes, genetic mutations where you really have no control over that. However, there are things that may reduce your risk of having breast cancer. One of the risks is obesity. Obesity has been linked to several cancers, and one of them is breast cancer. So I tell my patients, and doctors should be telling their patients that the weight is definitely, maintaining a healthy weight is very important. Keeping a low-fat diet, keeping a diet low in red meat. Alcohol consumption has also been linked as a possible risk factor. The recommendation is that women consume no more than 1 drink of alcohol and no more than 1 alcoholic drink a day. In addition, exercising, things like exercising, and although there is there hasn't been any clear evidence that smoking is linked to breast cancer, I usually recommend that patients stop smoking. There has been some research that suggests that secondhand smoke may have an increased risk of development of breast cancer. So I just usually tell my patients stop smoking.
Right, and there's obviously the risk for other types of cancers
Right,
of smoking
definitely.
as well. All right, well, thank you both so much. And before we go, I wanted to get a phone number in case anybody's interested in going get a mammogram at the hospital.
Well, actually, they can call the main number to the Imaging Services Department, which is 985-785-3662, and our receptionist will schedule your mammogram at that time. So we certainly would welcome a phone call and happy to schedule your appointment.
All right, well, thank you both very much for coming on the show today.
Thank you.
Catch the entire episode right here on Channel 6, daily at 5 p.m., or watch anytime at scptoday.com.